Welcome to Accessible, the podcast that opens the door to disability leaders and their ideas. I'm George Gatto.
And I'm Amelia Reigard.
We are doing something a little different in this special series called Voices of the Network. Over the next few episodes, we will highlight university centers on disability, which are currently facing funding uncertainty in the proposed 2026 federal budget.
We'll explore how these programs came to be, their bipartisan roots in the Developmental Disabilities and Bill of Rights Act, and the impact they have on people with disabilities, families, and communities across the country.
Through conversations with national and local leaders, trainee alumni, and professionals, we'll shed light on the real-world value of USEDS, LENS, and other DD network programs. These are stories of leadership, innovation, and impact.
Welcome back, folks. Thank you for being here. On today's episode, George and Amelia sit down with Dr. Eric Kurtz, Director of the Center for Disabilities at the University of South Dakota. He talks about how USEDS often work in the gaps between systems. So connecting education, aging, mental health, and disability supports to tackle really complex challenges in both rural and urban communities. Eric also highlights the power of storytelling and how lifting up voices of lived experience helps people truly understand the impact of USED and LEND programs. Before we get into today's episode, I want to share a quick update on our USED funding. The House and Senate Appropriations Committees have rejected proposals to eliminate or fold USED funding at this time. Yay! Thanks in large part to advocacy and engagement from people like you. So, thank you from all of us. That said, funding is not yet finalized. Congress is still negotiating appropriations, and with the possible government shutdown looming, there's real concern about how disruptions could affect services for people with disabilities. We will keep you updated as things evolve. Just a heads up, we did struggle with good old technology during this interview, so apologies in advance for any weird audio and people's voices sounding weird. It just is what it is sometimes. Also, George's mic completely stopped working halfway through the interview, so Amelia was left to steer the ship. She did amazing, but just disclaimer, we are doing our best. Thank you for your patience. Okay, here's the show.
I'm really excited this week on Accessible because we have a good friend of mine from the network, Dr. Eric Kurtz from South Dakota. Eric, welcome.
Thank you. Thanks for having me.
So usually we just like to start with getting to know you. And I guess the first question is, can you just tell us a little bit about your history, how you got into the field of developmental disabilities, and we'll start there.
Yeah, you bet. So I began my career and trained as a developmental psychologist. And the way that happened was during college and during my early training days was back in the 1990s, which sounds time ago now. But I was introduced to a variety of settings that were providing services to individuals with autism. And at that point in time, it wasn't widely known. There wasn't a lot of people around that had real experience, education, training, and background in that area. And so, one, it was something that really intrigued me, and two, I saw it as a way for me to kind of have a little bit of a different career path, as opposed to doing what everybody else did. So that kind of generally started my curiosity and sort of the direction that I took with my clinical work. And so when I finished my training, I basically practiced in every setting that would allow me in, from clinical and health sectors to educational settings, on the forensic world. I did a lot of work in a lot of different places and just really tried to bring that unique expertise and background into places that needed it the most. And at some point in time, I realized that I can't see everybody in this area, in this region. We need more people. And so I started to get into the teaching and training of the next generation. That led me to a LEND program about 15 years ago. I eventually became the LEND director back in 2013, and then continued to grow my work across systems, across different disciplines. And, one thing led to another there I need to be. So it's been a great, unique path. I've been very fortunate and I've loved really every day of it. So
So you're the you said director there in South Dakota, and also you have a LEND program there. So um, for someone maybe in your state who's never heard of a use ed or LEND program, how do you describe the work you do?
that's a great question. And I think it's one that we all kind of struggle with. And, I've been at work for 15 years. And as somebody who answers that question or tries to answer that question a lot or having that conversation, it's a tough one. It's hard. So, you know, I kind of start with just the high level sort of what are we after? What's our mission? What's our vision? Where do we want? And really, that is improving broadly the lives of people with disabilities as well as their families and supporting the professionals, the providers, the clinicians that provide services. So that's a big, broad mission. That's a big, broad thing to have. And so the way we do our work, and it's varied, and it's in a lot of different places with a lot of different people. So it'd be crossover sectors for healthcare, education, mental health, behavioral health. We in the work, even we in the aging space in a lot of places, and we're not living in any one of those systems in particular within our center. So that makes us unique. It makes us hard to understand and hard to sort of wrap your head around who we are and how we do our work. So we're kind of in the gaps, right? We're sort of, we live in the gaps, but we try to bring the different sectors together to think together, to plan together, and hopefully start to do more collaboration together. So that's, again, from my perspective as the USEP director, I'm not in clinic anymore. So what do I do every day? I get up every day and try to think about ways that we can bring unlimited partners together to solve really, really complex problems and do things that we're not doing now that we should be doing, or how to figure out maybe if it's not a first for us, at least it'd be a first for our state or our region. And that's the beauty with leveraging the network is there's always somebody somewhere that's probably a little further ahead than we are, or maybe, in another case, we're maybe a little bit further ahead than someone else is we can lend ourselves as a resource and support them. So it's a tough question to answer. It's really not one you want to answer when you're flying on a plane. But I'll usually keep it simple, but that's kind of the way is having that big broad goal of improving the lives and supporting people and their families as well as the professionals that support them, and bringing the various worlds and sectors and settings or organizations together.
Yeah. I really like that explanation of working in the gaps, right? Because from my work here over the years that the you said, right, it's like we do all of these needs assessments, right? We're figuring out like where are the gaps or what are the needs in our states that are impacting people with disabilities and their families. And then we're finding ways to, like you're saying, network build or work on those problems with different partners to be responsive to specifically what our states are struggling with or what they need. So, yeah, I wonder if you talk a little bit about some of the projects or programs or those big issues in South Dakota that you guys are tackling through your various projects.
Yeah, so I think one of the big ones, and it's getting more attention, I think more awareness now, but it's always been, I think, a strong area of our work and really a strong focus of our work, and that's in the area of chronic mental health and behavioral health,
Mm,
in
yeah.
particular, uh, mental health for individuals who also experience developmental and other disabilities. And that's a great example of how bringing these systems of care together is so important. And if you were to talk to me 20 years ago, you ask me what's the number one issue people tell you about, you go out and ask them, or you do a needs assessment. whether you're working in healthcare, whether you're working with educators, we working even in our direct support provider agency, serving adults with disabilities. Behavioral issues, mental health issues has been traditionally one of the top priorities that they struggle to address. So that's one that we've been working on for a very long time, but one that I think is starting to become uh, more top of mind for people in places that typically didn't think about it. So, for example, uh, 20 years ago, were going to the healthcare setting, doesn't matter for what. And for example, with a mental health issue or concern, you would almost meet or get referred to another place, another person. And it states, and I'm sure Missouri's got some same, you know, issues or this Midwest and Western states have is that we got rural areas that just really don't have a lot of resources or different types of professionals, providers, organizations to serve it easy. So that referral just kind of became a clip. And so you talk to people in healthcare and they tend to, well, mental health, that's not what we do. Go over here. We go into schools where they're seeing some of these concerns for the first time, bringing up those issues. Yeah, we'll talk about it. We can support them as much as possible. But if you really need true mental health, behavioral services, maybe go over here. Um, and then go over those places, and they may be very great at providing mental health services. But then you introduce some more complex issues, and on top of that, person may have a developmental disability or other disability, and that's where their sort of familiarity, comfort, competence sorts to wane, and they're not real familiar or comfortable treating people with developmental disabilities and fill up blank. And so we've got all of these settings who just really have done kind of great work to a point, and then it stops. And then where the next person picks up is sort of well beyond where when you start this person. So you've got these big gap areas. And so that's really probably one of the biggest systems level issues that we're continuing to face and to struggle to face. But we've got legislators, we've got police departments, we've got hospitals, juvenile justice system, and the criminal justice system at large. They're saying this is an issue, this is something to do to address. And for the first time in that I've been around, there are actually there's attention and some resources go into that. So while it's a typical issue, and I do think we're in a better place to address it now than we ever have been.
Yeah, things that I was thinking about that we are trying to address is this idea of service deserts, whether it's mental health or just health care of any sort. Who are some of the partners, or what are some of the things that you all are doing to? Because I know that you probably experience service deserts, maybe even more than we do in Missouri, but it's a real issue for people with IDD.
Yeah, absolutely. I think it's just an issue, especially in the western part of our state. It's an issue for every person. Um, you know, some people don't have primary care in their community, or if they do, it's limited or at certain days if they have an emergency. But further, um, so yes, we have deserts all over the place. But even in our cities, there still isn't enough to go around. So while people may look at that and go, "Oh, wow, you have all of these things, all of these different organizations, providers and professionals, and they're all doing wonderful things." And while yes, there are more in those places than maybe some of our rural and frontier communities, it's just not enough for everybody. So there's definitely deserts across the board. And one of the unique things that we're really trying to do, and this is just a great example of us sort of using our role of being sort of, we're not living exclusively in healthcare side. We're not living exclusively in education. We're not a state agency. We have this unique existence and this autonomy to be able to work across those lines and bring those parties together. So one of our efforts around pediatric mental health, for example, we're working with all of our big systems or health systems, which is a very difficult, sometimes complex political. There's a lot of competition and they don't often play well together, but they're wonderful organizations doing wonderful, wonderful work. But the reality is they don't possess enough of the resources, the expertise, or the footprint to address these issues, especially when we get out into our rural and frontier areas. So we're working with all of them. We're working with our state agencies, our departments of health, human services, and education, and social services, behavioral health, working with our small community healthcare clinics or federal qualified healthcare clinics and uh, places that are serving very underserved parts of our state. We're supporting their providers and their professionals and clinicians in those settings and connecting them with the resources that you have in the state and area behavioral health. So you realize we're not going to have a workforce in the next 5, 10, 15 years in some of these places. So what do we do? We need to serve those primary care providers and the schools that are already in communities, serving families, serving individuals, but need help. And we're here to bridge that and bring the expertise to those areas and to those providers, professionals, and families in a robust way so that over time, their level of comfort, they're exposed to these issues more. They're done so in a supported way where they're not just going it alone. And we're connecting them with ongoing UCME, continuing medical education so that, there's some incentive there and they're really learning. They're growing. And now rather than maybe seeing, some of these patients in their clinic that could typically be managed in that clinic, in that community where previously they were referred and had a full month wait for psychiatry, now they're better able to actually address those issues appropriately in one that the circumstance arises where they maybe do need to have a referral to someplace. Now we're better equipped to make sure that's a good quality referral and we're not using up some of those more intensive resources for individuals that wouldn't otherwise necessarily.
Yeah. I think that's one of the beauties of you said, the AUCD network, if you will, is that we aren't in any one space. And so we are able to create these bridges between systems, ideally. And the one thing that I think is unique about, or at least unique for most states about South Dakota, is you also then have these tribal governments. And how do you engage with tribal services or tribal entities, Eric, as you said?
Yeah, absolutely. It's critically important. And I think when we talk about our rural communities in South Dakota, uh, all of the issues that people in rural communities experience as far as their being further away from services, be more likely to be in poverty, have isolation, a lot of poor health outcomes. All of those things are certainly the case and even more pronounced in our tribal communities in South Dakota. But we do have 9 federally recognized tribes, sovereign nations in the state of South Dakota. And it is very important. We truly want to reach the entire state, then we have to reach those communities as well. There are certainly a lot of other more complicated factors that flow into that, but it all comes down to relationships. Knowing people, having comfort, trust. It's not easy to establish. And I think if humans in general, it's just people aren't as trusting as they used to be. And so you build that trust over time with relationships. I mean, you with, walking down a path together, working together. It's a strong part of our center. It has traditionally been giving the outreach to our tribal communities, tribal members, reaching out to tribal members, working with those community organizations, working with tribal elders and tribal governance. And it's certainly something that requires ongoing, constant, genuine interaction. So there's been a lot of experience in those communities where somebody will say, "Hey, just got this federal grant, and we want to learn about this, or go provide these services here or there," and that's really perceived, in not a positive way in many cases, and rightfully so because it was a sort of here today, and then the next week they're on, and there's really not much left, after the fact. And so what we've tried to do is establish long-term, long-standing relationships that are mutual. So we're not just trying to pretend like we're all experts here. We're going to import the expertise into this community because you need it. We're going to get to know you and go, what's important to you? What's on your mind? What do you want for your relatives? Yeah, how can we help? And how can you help teach us how to be better? So we're all in this together. We're all learning from one another. And that's been really just amazing experience over my career is getting to do that. And it's a really deal to have done that work. And we're fortunate to have people in South Dakota and beyond that want to support that work and that are happen to be tribal members and wanting to go back and serve the tribal communities that they represent. And it's a beautiful thing.
Do you have Len students that come from some of those tribal communities to participate in your Len program?
Yes, we do. It's been so great. So we've had a lot of different programs or different training opportunities that have exposed maybe even undergraduate students that might be at tribal college or undergraduate students at one of the universities that we work with through our LEND program at a graduate level or income for medical students or postdocs. And they learn about that and they just want to be involved. It's something that they probably thought about or had experience with, but never had the real opportunity to get that expertise. So we've had some great stories of meeting students when they were basically teenagers or in college and getting them exposed to just what we do, the world of healthcare, the world of education, or the variety of different disciplines that are represented in a LEND program. And they ultimately become LEND trainees and they ultimately become amazing providers and leaders in their communities. And then we have that connection. So one of our biggest success stories is I'm sure she won't mind. Her name is Keita Sam. Amazing story, and I mean you could have her on his podcast, and I think would be a wonderful way to tell her story and share her success, but also teach a lot of people about the issues that are important working at their tribal communities. But yes, we would keep those connections. They continue to give back. They continue to make a difference. It's a wonderful full circle thing to see. We're all stronger. At the end of it, there's no end, but we're all stronger as a result of having that process continue to be part of the work.
Very cool. Yeah, we'll have to have her on as a guest, and we've had some former Len trainees on as a part of this Voices of the Network series, and it's always really enlightening to hear how their time in Lend and that kind of cross-disciplinary exposure and training has really helped them in their career. And also we hear a lot about the value of how Lend trainees learn from one another. So for her to come and bring that tribal community, perspective and expertise to the table too, I'm sure enriches the experience for all the Lend trainees, which is really cool.
I just love I actually have a real fun place for South Dakota because my early career was spent working with.
The whole comment's not going to come through, I don't think. I mean, it's not for me, I guess. So, do you want to try one more time? No. Okay. So Eric, being in the network for as long as you have in your career, both as a LEND director, as a USAID director, are there any stories that you kind of carry with you that were really impactful, that kind of keep you in this network and keep your work going, or individuals or people that you've met along the way that kind of help propel you forward and have impacted your journey as being a part of a network?
No, absolutely. And man, I mean, it's just been such an amazing experience. I, I didn't know about the network during my training. Unfortunately, I didn't have an opportunity to be a LEND trainee. I wasn't involved in the great work that our USAID was doing. And so by the time I came to sort of discover this whole network, I was blown away immediately by one, it's just the level of expertise. The organizations, the universities, the academic medical seminars, just everybody that's involved in this network is just it's unbelievable. But beyond the expertise and wonderful people is honestly and I have stories. I have a dozen. I could just rattle off of just an example of the collegiality, the willingness to collaborate, work together to support one another, and genuinely do so, not in a way that's self-serving or I can get something out of this. It's it's truly people are doing this work for the right reason, and that's something I had not experienced prior in my career to that level. We're always fortunate to meet a person here or there that, just was just an amazing, outstanding, genuine, uh, good person and, great professional. But this network is, I think those words sort of that just embodies the entire network. So that's one of the things I think that keeps me and a lot of people around. It's that when you have a question or you want to do something. I mean, that's how I got to meet George. We were doing some work. Our state asked us to, to head up this statewide needs assessment in the area of brain injury, and they asked for just right at the perfect time in the middle of COVID. So, we had to kind of prioritize and say, may not be the right thing, the right time for us. And so we initially sort of turned it down and said, we'll support it, but we can't take the lead on it right now. But we understand the need for the work. We want to do this, but we'll support it. Well, another year went by and they came back and said, we're really, really wanting to get this up and running. We think it's a great time across our state. We think it's a good time to approach our state agencies, legislators, to try to, but we need data. We need data specific to South Dakota to help make the case for the things that we want to make happen. And so I just reached out to AUCD at that point and said, "Hey, who's done similar work in this area in the last couple of years? I want something fresh." And the first place that came to mind was George and VMKC. And I'm like, "Oh, I know those guys. They're saying so." It was so just phenomenal just to get connected with them, and they jumped right at it. Didn't even bat an eye. Said, "We'd love to help." And so rather than recreate the wheel and take all this time and unnecessary sort of, expense to create things that have already been created and worked well, you all came in and helped us get off the ground this kind of a phase one statewide needs assessment. And that's just one example of, he didn't have to do that. He didn't have to say, yeah, I'll give him, time and, people and resources to support this, but you did, and that's just a great example of how the network comes together to support one another.
Yeah, that's very cool. I've worked on when I was a young research assistant, just starting out here at the USED. I worked on our traumatic brain injury project and program here, and that's been around for a few decades. So that's very cool. And I think we heard something similar when we spoke with Marcia from New Mexico, the USED director there, a few episodes ago, and she talked about a similar experience. Just they're doing some big work too on mental health, the intersection of mental health and disability. And they reached out to someone else in the network, right, who had piloted a project on mental health and to kind of get theirs up and running, right? So there's this huge value in having this federal designation that creates this web of connections in which we can all rely on one another and say, what have you done? What's working well? How can we implement it in our state to serve people with brain injury in our state, or fill in the blank, whoever the population is, whatever the need is. It's such a huge asset to have.
Absolutely. And shout out to Marcia Moriarta in New Mexico, because when we were in the beginning stages of establishing our pediatric mental health care access program,
Yeah.
she was one of the people that I connected with right away, because they're union, they're a USED, they're a land union, and they also are running their pediatric mental health care access
Yeah.
program. And again, same thing. She, within the day, responded to an email and was so gracious and supportive in helping us get, the initial planning stages of our PMHCA program. So, well, I've got a dozen of those examples, and so
Yeah. Very cool. And I'm sure, for certain states, like when I think of some of the stories we heard from Marcia in New Mexico and South Dakota, both being really rural states or where populations are really spread across, large areas, geographic areas, that even being able to brainstorm and strategize around those types of things is really helpful and such an asset.
Yeah. So I think I agree that it
Can you
is.
start over, George? Try one more
Yep.
time, start over.
It's amazing.
No.
I also think it's like a
Sorry, George. So one of the things that we talked about in a few of these Voices of the Network interviews is just how traditionally USEDs aren't used to advertising ourselves, right? We're not used to being front and center and kind of promoting our work or promoting who we are and our existence, right? We're talking about the projects, the work, the partners that we're bringing together, right? And so I guess in this in the times that we're in now, how are you, or do you feel like there's been a shift in how you're talking about your USED and the importance of your work and the value you guys add in South Dakota and nationally?
Yeah, absolutely. I think we're guilty of that. I think just like a lot of centers are. I mean, we do certain trail to spread the word about the work that we do, but we're just really not that great. And it's been one of the things that's on my list of things to do is to be much more strategic in the way we market and communicate about the work that we do. But that being said, it's still coming from us. And I think that in many cases, if you have somebody else of influence, somebody else with experience that can also share that story, tell that, tell somebody about the work you do from their perspective. I think that's to me been the most powerful ways that we've been able to kind of spread the word about not only what we do, but the importance and the outcomes of what we do. And we've done that on very small individual levels, so one-on-one meetings or um, w- small group kinds of things. But I think that's what we're trying to do is to take that and amplify it. So thank you guys for doing this because I think that this is one of the ways that you can amplify a voice. You can amplify a perspective or an experience. And I don't think we're very good at it in our case. We're trying to do better, and I think that's just one of the weaker areas of us and the work that we do. Yeah, it's hard. It is hard. Again, because you just ask people about what your center is and what you, and that's hard enough to describe. And you know, you gotta feed somebody information that's not looking for it. You're not sitting back and going, "Hey, tell me about your place." So we have to find people in places that are not expecting to hear about the work that we do, aren't knowledgeable about it. And to me, the one of the best ways to do that is to ground it with stories of real experience. Whether it's a former trainee that has had an amazing experience with not just the training program, but what did it help you do in the career? And so then you have them come back and say, "Oh, now I am actually doing what I had the benefit of receiving, which is training, providing clinical experiences, research opportunities, and leadership development for the next generation so that kids of 10, 20, 30 years are going to have access to services, supports that they need." We're a family. I think of the families and the parents that we hear about, in the clinical work, you don't often get a thank you. It's fast paced, it's here, it's high stress, it's anxiety, and then they're gone. And it's just amazing to hear a story that was, from 10, 15, or 20 years ago about a child who, you saw in clinic at 2 or 3 or 5 years old, and now they're graduating from college and have a great career and a family. Those stories about how the work that we did helped them have the life that they want. I mean, you can't get anything, I don't use anything more impactful than that. So we're trying to help tell the story a little bit more. And I guess the one thing I will do is, since we're not good at tooting our own horns, and you do have an annual publication that you put out, it's called Possibilities. And really it's about stories, it's feature stories, pictures, and great interviews about people who have been impacted by the work that our network works. And it's very, I guess, just kind of diverse in the way that it could be a former trainee, it could be a parent, it could be, a provider, a professional out in the field that, was able to get some training and that changed their career and it changed the impact that they have on the individuals that they work with. It could be a parent. There's just so many wonderful stories for us to tell. And so we do that once a year. We put together a really nice, high quality magazine that features people that have, handled challenges and, have been successful in the face of so many things that they've experienced through Meanwhile. So I guess that's one way that we do try to kind of do what I just described, but there's always room for more.
That sounds like an amazing publication, and we'll definitely share the information about that in the show notes for this for those that want to check it out. And I think there's something else that you said just about capturing those impact stories of individuals and families, right? And oftentimes, right, when you know that you're provided a service or you've been working on a project that's going to have like long-term impact on somebody's lives, but we're not necessarily doing these long longitudinal studies, right, where we're following everyone who ever interacted with a USED related or LEND related project or trainee. Can be sometimes really hard to track those things down, but super important to share the impact it has on individuals. And so the Possibilities publication sounds like a great way that you guys highlight some of those big successes. Well, so Eric, if people want to learn more about you and your center and the things that you guys are working on, how would they go about doing that?
I would say go to our website, like everybody says, but our website is not always the most user-friendly. It's one of those things that's not completely under our control, but certainly go to our website, at least to connect with people. So go to our website, find somebody who looks interesting to you, you reach out, get us a call. You've got people that answer the phones all the time, and they get calls from all over the place, and they connect those calls, each and every one of those calls, with somebody who responds. So we have amazing people at this place, and I would say just reach out to somebody. You can reach out to me directly. You can reach out to anybody who's really a part of our center. You just get connected out. Personal connections are powerful because you won't find everything that we do on our website, unfortunately.
Sure, yeah. One of the other struggles of capturing all that we do. Couldn't possibly put it all on a website, but that's great. That'll be a great front door for those that want to get to know more about the work you guys do. So, Eric, thank you so much for being here with us, with George and I. And it's great to hear about the things that are happening up in South Dakota. And George will just have to send you a text later to say thanks for joining.
Yes, thank you for having me. Thank you for the work that you're all doing, not just with this podcast, but the broader work that you're sending, Steve. It's a pleasure.
Yeah. Well, it was a pleasure to have you here. Thank you for listening to this episode of Accessible. Accessible is hosted and produced by George Gatto, Amelia Reigard, and Catherine Toller from the University of Missouri, Kansas City Institute for Human Development, which is the home of the Missouri USED. Accessible is a joint project between the Missouri USED and the Missouri LEND program, which is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services through grant number T73MC00022. Episodes of Accessible are released every 2 weeks and can be found wherever you subscribe to your podcast. Join us next time to hear more insights and ideas from leaders in the disability world.